Hey, YouTube, I'm live. I'm live. I'm live. TikTok, I'm live. I'm live. I'm live. TikTok is not done setting me up yet. Oh, here we go. Here we go. People are coming in, coming in, coming in. All right, Andy P, Lily Star. All right, I can't say that one. Kimberly Ruick, Akani, George, Gia, Shane, Hans, Irma, Edie McClendon, Sarah Richard, TTK, Cindy Ann. You don't have to worry about not being totally quiet. Just do what you do. Sherry, Sheila Lewis, Athena. Hey, Athena. Donna Clay, Roe, David, Coco. Coco's here. The moderator is du jour. Coco.
Hello.
Hey, how you doing, lady?
I'm good. How are you?
I'm excellent. Phenomenal. What's that feedback going on?
You know me.
Okay.
It's worse.
100%. 100%.
So if you don't see a bunch of typing from me at the moment, you'll know why.
Don't even stress yourself. I will try and do my best with my nimble fingers. You would think I would have taken your hint and set.
I should be stationary probably about 30, 40 minutes.
Okay. You would think I would take your hint and set up some copy and paste for myself, but I don't do that.
No, you're good, girl.
It
You're good.
is what it is. So I'm live on TikTok. I'm live on YouTube. I'm back here again. Phone is ready. All right, the phone is ready. Hang on. I gotta finish typing a note to someone. And we're done. Okay. So TikTok, I'm here. Yay. I'm also streaming on YouTube. And I'm waiting for questions.
Looks a little slow tonight, but that's okay. Usually gains momentum in a little bit. We got 20.
Yeah, exactly.
We're still under 1,000 on the likes, so please tap party.
It quickly got to 947. I only been on for a couple minutes. Oh my gosh.
Alrighty. I put my eyes on the road. So, excuse me. I was going to ask about the dropper. And I meant to talk to you about it before the live has started. The dropper on the lid, it seems like the liquid comes out faster versus, and that's the 2 ounce, versus on the 1 ounce that you use for the Vitalize, it actually is not, and I don't know if that's because it's a little bit thicker with the Revitalize. Is that
No, it is a different dropper. The dropper on Revitalize,
Right.
it's got a little like a little
It has the, like, the little, like, groove or whatever you want to call it.
yeah, on the bottom it's got the like this little glass little stopper thing almost on the bottom.
Right. Would that slow it down a little bit
Yes.
for coming from coming out of space? Okay. With my order, have you already sent my order out for the pain cream?
It probably went out today.
I had texted you about it yesterday.
So it may not have gone out today. I sent like four of them out today, so I'm not sure.
Okay. If you can, when you send it out, can you include the other dropper to see if that'll help? Because I'm actually losing more product because it's coming out so fast.
So like the 3070? Is that what you're talking about?
That you use for the Revitalize, that's 1 ounce.
Yeah.
If you can send that, for the 3070.
Okay. Yeah, that's actually a half ounce for the Revitalize.
I couldn't hear you.
I said that's actually a half ounce bottle for the Revitalize.
Okay.
Do you want me to just send you an empty half ounce bottle?
Yes, with the dropper, that would be excellent.
I can manage that.
Thank you, dear.
You're more than welcome. These are things we can do.
And guess what I didn't do last night? I didn't give them that vibration plate.
Oh. Well,
Good, Dana, I don't hear she ain't gonna chest
I'm gonna tell later, don't worry. I didn't get on today. My body hurts from using it yesterday. So I took today off and I'm gonna get back on tomorrow. But I enjoy using it.
Tomorrow is your rest day.
Yeah. And I have my mental mastery class from 10 to 12. And then I'm making product for the rest of the day into the evening. And my distiller came. So I said that a customer of mine, who I now consider a friend, we were talking just about all these different things to benefit health. And she's like, you have to get a distiller. And I'm like, well, what's that? And it's actually a machine that makes distilled water. You fill it up with a gallon of water and it makes distilled water from the tap water or whatever water you use. And I have a zero water filter, like a Brita filter. And she's like, yeah, no, use that, filter the water into that, and then filter the water into the distiller and see how much residue is left over. So I'm going to do my tap water the first time, clean it up real good, and then do the zero water filter and put it through the distiller and see what happens, because it takes everything out of the water. And then she recommended that I add.
Oh, yeah, she recommended that. Yeah, and then test it, because you can always get test strips. I mean, it's no different than what the water companies do anyway.
No, 1,000%.
They run it through a filter.
Right.
So
Yeah. So I'm gonna do that probably on Sunday. All right, we have jumped up. We have got 49 people in the room, and we are at 3,500 likes. Look how quickly that went. Exquisite Treasures, thank you for all of the likes. I appreciate you. Okay. I'm looking for questions. I'm scrolling for the scroll. Here we go. JJ. Hello, could I put castor oil on my dog's skin tag on his eyelid? Sure, you could. Absolutely. So castor oil is beneficial to pets too. 1,000%. All right, I'm still looking. I'm looking. All right, I don't see any other questions. So this is what I'm realizing. We got 40 people in the room and one question. How's that happen? May, thank you very much. I received my package today. I have the 4-9 and Revitalize. Which to use? Okay. Coco, I'm going to mute you so I don't have feedback while I'm giving instructions. Okay, so May, here's what you want to do. I want you to use the Revitalize 5 to 6 times a day for 2 days. So for 2 days, you're only going to use the Revitalize. That's going to moisturize and hydrate the eyes so that, one, they're nice and moist and they're ready to accept all the ingredients that are in the 4-9. Two, that the 4-9 doesn't just sting like crazy or burn when you drop it in the eye. So 2 days, 5 to 6 times a day. And Revitalize is easy. This is the bottle that you get. And this is the dropper. So you're gonna, let me set that down. This is a dropper, clear wet liquid, and you're just gonna drop that in the eye. And it's gonna take a couple seconds to normalize. So in my eyes, it's always gonna have a little sting, but it's not gonna be significant. And I don't have a towel here, but very quickly your eyes will normalize, the fluid will penetrate into the eyes, and you'll be happy go lucky. So it takes a couple of seconds to do it, easy peasy lemon squeezy, and then once your eyes are nicely moisturized after a couple of days, then you're going to want to start using the 4-9. You want to use the 4-9 twice a day, morning and evening. You want to, have the Revitalize, use that first. Then you're going to use the 4-9 right after you use the Revitalize. So now that my eyes are normalized, I would drop the 4-9 right now. And then what you want to do is when you drop the 4-9, you want to close the eyes for about 5 minutes. Let it penetrate. Just close your eyes, relax, breathe, enjoy, and then you can start to blink, open your eyes, and the 4-9 will have penetrated into the eye, and you're good to go. So that's the process, May. So give yourself the 2 days of using the Revitalize 5 to 6 times a day. That will really condition the eyes to make them ready to rock and roll. And you will probably notice that you have some benefit in your eyesight using just the Revitalize because it moisturizes the eyes, and all of our eyes are a little dry, a little too dry. And it actually makes a difference having nicely moisturized eyes. Okay, Tony Wizard. Hi, I'm interested to talk to you. My queen. Thank you. So I would like to know how to get to talk direct to you. So Tony, I'm going to invite you up. So I'm going to invite you up on the panel. And then also up above my head, you will see this set of numbers. And that's actually my phone number. And you can actually call me there. And then you can also see my website is directly below that. So you can call me and talk to me there. You can come up on the panel and talk to me here. Whichever way you want to do it, it's perfectly fine with me. Robert Annis, how you doing? Hello, beautiful, my sweet Leslie. I've missed you. I have missed you. Come on up and say hello. Hang on. Tony, how you doing? Hi. You got a lot of background noise.
Yes, I'm moving away from it.
Okay.
Family here in this house.
Okay, excellent.
Right. You hear me better now, right?
Yes.
Well, basically, I was a national lawn tennis player.
Okay.
And I used to play lawn tennis.
Yes.
For Trinidad and Tobago. And I got, simply put, I got a lash in my eye while playing a lawn tennis championship in the West Indies. That was I am 74 now.
Okay.
Right?
Yes.
That happened when I was 27.
Wow.
And it's only now that it seems to affect me.
Okay. So explain to me how it affects you.
Okay. You know lawn tennis, right?
Yes, I do.
I learned to return a service that the guy put to me.
Yes.
Caribbean Championship. And when I stick my racket out, he stick my racket and come straight off the racket and come and give me a real 112 mile per hour struck to my eye, left eye.
Wow.
Right?
Yeah.
And at that time, I was in St. Croix, right?
Yes.
I was only able to see head in my left hand. That went on for about 2 weeks. Then it just gradually came back to normal. But you know what? That's the second time you did that. During that time, I got some treatment. I got Dr. England, and I eventually came back, but they did some tests and so on and so on. As an international player, I was afforded the luxury of the royal treatment, you know?
Yes.
So I'm thankful for that. So everything went well, and my retainer in my eye was never detached. It was just blue and struck the eye and made my pupil dilate. So it came back to normal. But within the last 3 years, right?
Yeah.
It's the COVID that I got has affected me.
Okay.
So I got COVID, right? And I came through pretty good. Not having to take the vaccine or anything that I have none. As a fourth one, I maintained movement. So I believe that. Last week to check my eye. I've seen a little blue, and right now I'm wearing glasses for the past 2 years, right?
Okay.
Recently, it blew on the left eye. Is of such that if I close the right eye, I'm not able to read writing, normal writing, like a newspaper.
Okay.
Normal around that blue in the middle of my eye. But what they told me in the hospital is it blew into my eye was so precise that it sent a shock straight to the middle of the back of my eye. And it has left a scar there. Right?
Yes.
Like what they call when you scrape your hand against a wall passing and then it's healed with a little scab.
Yeah, they're saying you've got scar tissue.
Right. So they say that the eye itself, the whole eye is pulling because of that scar not being able to be flexible.
Okay.
So your eye is supposed to be flexed to suit the light and
Yeah.
But they say I don't have a cataract problem. I don't have any problem. I don't have bleeding. The pressure in my eyes to the put it to all kind of this. And the doctor laughed. He said, you have a unique injury and we don't have anything that could heal that. But they gave me about 6 different places in Trinidad where they carry out that special test to make sure that everything is still alright for us. You understand? So now that I saw you on the net about 8 months ago, and I lost your contact. And of all times, the night, just about 10 days ago, I went to the hospital and they gave me a clean bill of health. They said, all of that was a scar at the back. It is still direct to the right. But they can't go to that. But that's a kind of expert surgery they have to do. But I have to get the advice of these specialists.
Right.
But now that I'm seeing, I'm thinking of answer question, because they give me until the 10th of the 9th month, come back to the hospital with test results from one of them. And the 10th of September coming, I have until then to come back, if not before.
Okay.
I wanted to talk to you directly for the same reason, to find out, based on what I explained to you, what product you want. And I live in Trinidad, Western.
Yes.
Right? So I want to know what product you have that probably help me and what cost.
Okay. There are 2 products that I would recommend for you. The 3070 and the 4060. I would recommend you get the 2 ounce of the 3070 and the 1 ounce of the 4060. And the way I would recommend you use them is you're going to use the 3070 and the 4060 together in the morning. Then you're going to use the 4060 midday, and then you're going to use the 3070 and the 4060 together at night for 7 days. After those 7 days, you're going to use 3070 in the morning, 4060 midday, 3070 at night. And you're going to do that every day until you get the results that you need. If the issue is scar tissue actually in the eye, the castor oil will dissolve the scar tissue. The castor oil has to get deep enough into the eye to get to the area where the scar tissue exists. And yeah, so it's got to go very deep, which means you need to have enough castor oil to actually be effective in the area and enough DMSO to get it back there deep enough. but not so much that we wind up, causing any kind of extra trauma to the eye. So the 3070 is a little, it's 30% DMSO, 70% castor oil. The 4060 is 40% DMSO, 60% castor oil. What I want to do is for the first week, get enough castor oil and DMSO in the eye on a regular basis that it has the option to start working on that scar tissue and to actually make wherever that scar tissue is more pliable. So as the castor oil gets into the tissue, it's going to break it up so that the tissue itself is just more pliable. Okay? And then it's going to start dissolving that tissue. So we want to get enough in there for the first 7 days to make it effective right off the bat. And then after that, we want to keep that level up high enough that you're going to consistently have benefit coming your way using the castor oil and DMSO.
Like I said, within recent years, my eyesight has just come here. Right now, you know what I feel too? You know, like when a little speck of dust gets in your eye.
Yes.
And you say, hey, I'm going to get driver. You don't use a thing that up.
Well, the 3070 is beneficial to help your eyesight have more clarity and focus automatically. So that's going to be helpful to both of your eyes. Just yeah, and it'll take care of the floaters. So there's a lot of things that will be benefited using the 3070 and the 4060. But the goal is to not just benefit the thing that you can easily have access to, but also benefit the back of the eye where you've been diagnosed having the scar tissue.
And that's the only level. You like that's probably I'd say how do you call it? Macular degeneration.
Your macular degeneration, yes.
But you know, that guy doesn't have a problem. It's just
okay. So both of those blends will be beneficial in the eye for the floaters, the macular degeneration, and the dissolution of the scar tissue.
Okay. Right. So the big question, burning question.
Yes.
How much does that work? Where can I get that and what?
You can get it on my website at bearcatbody.com. We ship worldwide. So the 3070 for 2 ounces is $39.50. The 4060 for 1 ounce is $26.50. And then all you would pay is shipping.
All right. So the total cost for the product that I'm supposed to be taking is how much?
Well, you want me to calculate it right here? I mean, I don't have your address, so I can't tell you how much the shipping is going to be.
Well, I'm as I say, I'm Trinidad, right?
Yes.
Country. Live in Trinidad and Tobago, but I live in Trinidad,
Yes.
the larger country, of Venezuela, in the West Indies.
Yes. So I understand that, but without an actual address, I can't calculate the shipping. I imagine it's going to be less than $40. So the 2 drops I'm recommending and the sizes that I'm recommending is a total of $66 US.
Okay. So basically, give and take 80 US.
I'm sorry?
I said give and take about 80 US.
Well, it'll probably be closer to 90 US, depending on, the shipping is probably going to be $30, $30, $32, $34, something like that.
So safety, 100 US is good.
Yes.
All right, my dear. So you keep up the good work and Nobody meets people by chance in this life. You know that?
I'm sorry, say that again?
I said, no one meets people in this life by chance.
I agree with you 1,000%. I agree with you.
Because look, that's what they call what? They say they call the karma. You know?
Yes.
So I have to organize myself, funds and so on. I'll get back to you.
Okay. You can go whenever you're ready. You can go straight to the website and order off of the website, and we'll ship it to you within a couple of days.
Okay.
Okay?
All right. Let me take a speed.
Do you have everything you need, Tony? Okay. Okay. I think Tony's good. Do you need anything else, Tony? All right. Okay, Tony, I dropped you down. If you want to come back up, you can, but I thought you were done, so I wanted to drop you down. Robin, you can unmute yourself and let's have a chat. Oh.
Okay, I think I did.
Hey, Robin, how you doing?
I'm good. How are you doing?
Excellent, excellent, excellent.
I'm so glad.
Thank you, thank you, thank you. How are you doing?
I'm okay. I have some news. I went to the doctor.
Yeah.
They go name of this specific doctor for cataracts. I found out that my left eye is really good. It's not good, but it is not as bad as my right eye.
Okay.
My right eye, they told me it is so dense, they cannot see to the back of my eye. They can't make a light go straight through. They're saying the cataract is almost like a leathery jerky effect.
Okay.
They're saying that would be a high risk for me to even have surgery with that. If I do want to have surgery, they recommend that I went and did my left eye first because I can still see pretty much with my glasses. I can see, not as much as I'd like to. My quality of life is not where it needs to be. Like she said today, yesterday, she said it's really not the way it needs to be. But she said that this is completely up to me. And we talked a little bit about what I was doing with you, and she wasn't really into it. She's been doing, what was her name, baby? I mean, what she's called, the doctor that she's called.
I don't know. She did start.
No.
An ophthalmologist?
That's it. Thank you, Mom. That's it. A kook, my husband said.
A kook. I didn't say that. I just want everybody to know. I didn't say that. I just repeated it.
He told her about what I've been doing with the regimen that you gave me, and she said, well, I don't foresee it that healthy. And I wanted to tell her, well, it does. It does. It has. But I wanted you to have the new information and tell me, so now you know what. I'm supposed to call them back Monday. They did not tell me which one, if I'm a 1, 2, 3, or 4. I'm sure my number 4, my right eye is 4, with them saying you can't see even to the back of it.
So that's what they can't see. But exactly. The true test is what can you see?
It's very hard to see out of that eye. I can still see things, but I have to hold them to my face.
Okay. So
Yes.
here's what I want to do. I want to talk to you off the live, number one, because it's going to take like 40 minutes for us to go through this conversation. But what I would like you to do is to actually cover your good eye.
Right.
I want you to close both eyes, cover the good eye,
Right.
and then open the eye with the severe cataract.
Yes.
Blink a few times and then tell me what you can actually see.
Okay. Well, I can tell you right now, I can see everything I'm looking at with you. And
Yes.
the eye, but it's distorted. It's almost like pixelated.
Okay.
Does that make sense?
Yep. That means that you've got cataract buildup heavier in some areas than the others.
Okay.
Which is great. That's just great, because that just means the cataract hasn't, really covered over the whole lens of your eye, which is great. So the next thing is you're using the 3070 drop, right?
I have the 3070, I have the 4 in the eye, and I have the eye drops. The lubricant.
Revitalize.
Yes.
Okay. So on the eye that has this serious cataract buildup, we need to change up the protocol using the 3070 and the 4 in eye.
Okay.
Are you using prescription drops?
No. Only what
Great.
you gave me.
Great. So I want to change up the protocol, the way you're going to use these drops consistently, over the next 2 weeks. I want you to give me 2 weeks to help you get that cataract breaking up and to continue to test what you can and can't see. I'm going to need you to agree to sun gaze every day.
You want to go out and sit in the sun?
Yep.
Okay.
And I want you to stare at the sun with your good eye covered and only the eye with the serious cataract, open and staring at the sun.
Straight at the sun, no glasses on?
No glasses, no nothing. Early morning light.
Okay.
So no later than 8:30 in the morning.
No later than 8:30 in the morning. All
yes.
Right.
And I want you to do that every day for 5 days.
Okay.
And then what I want you to do immediately after sun gazing is to use the 4 in eye and the 3070 back to back.
Then
which one
first?
The 4 in eye first and the 3070 second.
All right, darling.
Then in the
drop at each eye?
Yep.
Okay.
Yeah, and you can do this in both eyes. That's fine. Then midday.
It won't hurt the other one?
No.
Okay.
No. Then midday, I want you to also drop the 3070 and the 4 in eye midday.
Again. Okay.
Yes. And then you're going to do it again in the evening.
Okay.
And then what I want you to do in the evening is I want you to patch the eye, the one with the severe cataract, patch it over.
Patch it over.
For the whole night. So you want to wear a patch while you sleep.
Okay.
We're going to do this for 7 days. And then we're going to see where things, how things shift in that 7-day time frame.
Okay. Do I use the lubricant at all?
Yes, use the Revitalize. Yes, absolutely.
Okay.
Absolutely. And don't do whatever you do. I'm not trying to, push you to do any one thing.
Right.
Whatever you do, if you go to have cataract surgery,
I don't want to.
I understand, but do not have cataract surgery in your good eye first.
Okay.
I know it might be more difficult in their estimation for you to have cataract surgery in the bad eye. Yes. And I'm going to put this as plainly as possible. If you go to the kook and the kook screws up the good eye.
Yes. Oh my God.
Then what do you have left?
Exactly. I love that. I can't wait to tell my husband what you said. God, I love that. I so love that. Oh,
I'm just repeating what he said. No, and it's an honest thing. I understand their desire to do the easiest thing first.
Yes.
But the easiest thing first could leave you without quality eyesight.
Exactly. Okay.
So you don't want to put that eye at risk right off the bat.
Right. And see, it makes so much sense why I put the good eye at risk for something that might happen. Every time I don't think nothing's going to happen to me with my health, it always does, Leslie. It always does. My blood disorder, my anemic, my cancer,
Yes.
everything. It's just, my God. So everything that could possibly go wrong to me goes wrong. Now, they had 3 people come in and look. Oh, wait, my eyes are very little and the pupils will not get bigger, so they have to dilate my eyes.
Right.
And I'm like, okay, I don't care how pretty they are, I just want them to work, you know?
Yeah, no, 100%. I really don't need a good looking mule as long as the mule can do the work a mule needs to do.
Thank you. I don't care how they look, I just want them to work. That's all I want.
No, 1,000%.
Yeah, but they brought in the head person, then another person, and another person. I'm thinking, my husband and I was thinking, because my pupils are so small, and they couldn't get them to get even there with shining light on them or whatever. So finally they did dilate them and they did get bigger, but otherwise they was a budget.
Well, you've had so many issues
Yes.
recently. I dare say that there's no way that all of the medications that you've taken in the recent past have not had, a sincere effect on your whole entire system, not just.
Oh, yes, because when they give me transfusions, they give me steroids because I don't heal and I don't accept iron. It not give me iron intravenously. My whole body will shut down. It will be done.
Right.
So I cannot, in my mouth, I can't take any type of iron, or it completely throws my body out of whack. So when I have blood transfusions, they have to give me steroids to make the transition go when my hemoglobin drops to like a 2.
Right.
So, yeah, there is some issues.
Well, I want you to realize that there are alternatives. Those alternatives you already have in your arsenal. Oh my gosh. Sorry, somebody keeps calling me. You already have those alternatives in your arsenal, and you can use them in a way that's going to benefit your eyes. We're going to turn this around and move it in a different direction. And, your husband can go back and tell the kook, how do you like me now?
Right. And he will too. He's that type that he go back and say, well, how do you like it now? I thought you didn't believe it's natural. Here we go.
Exactly. Just saying. I'm just saying.
Right.
But yeah, I don't think you need to go through that level of intervention, and I don't think you should put your good seeing eye at risk for cataract surgery. First time that we're going to do your best eye first,
Right.
and if anything goes wrong, we're going to leave you with that bad eye, and good luck.
Right. I love you. Thank you so much. I didn't even look at it that way. But my main thing was I wanted to come home and see what I could do with what I already had because I don't want surgery.
Yeah, no, you don't need. I'm sorry.
What's wrong with me? So no, I don't want that.
Yeah, one of my best friends, he's been in the same boat. Like he had a very severe cataract, and it took him a year of treating it. I don't think it's going to take you this long, but it took him a year of treating it to get that cataract, solidly moved away from the lens of his eye.
Right.
using my products. But he was like, I won't have surgery because every time I've had any kind of surgical interaction, the worst case scenario has happened to me.
Right. Exactly. And that's what I'm scared of.
Yes, and some bodies are different. His body rejects things. He had a cut on his hand, a huge gash on his hand. Went to the emergency room. They stitched him up, and covered it up and did the whole 9 yards. They're like 3 days from now, you need to uncover it, let air at it, yada yada yada. He opened it up, and within an hour, the whole cut had opened back up.
Exactly.
So
see, it's always something.
Yeah. His body rejected the stitches that they used.
Right. Well, I'm gonna. I guess you want me to message you or call you after the live, or what do you want me to do, Miss Leslie?
I'm gonna hang on. Let me see. I think I have you on my phone. Let me see.
Okay, darling.
Let me check real quick.
All right.
Oh, Robin, look at that. I have you on my phone. I'm gonna text you.
You love me.
Of course. I'm going to text you the instructions that I want you to use, and I'm going to give it a little more thought. So I'm going to think about it just a touch more, and I'm going to text you first thing in the morning. I might text you tonight, but I don't know when I'm going to get off the live and all of that. So I don't want to guarantee that. But I am going to text you either tonight or tomorrow so that you have how you need to use these products to actually get that cataract moving.
I will look forward to hearing from you. And if you need me to, I can screenshot the papers that they gave me and send to you. They're supposed to let me know Monday. They did tell me, of course, my right eye is very severe. It's a very high-risk surgery. And they didn't tell me, though, whether it was a 1 or a 4. I'm sure it's a 4.
It's got to be.
I don't know. But I know I don't want to do, like you just said, just go and operate on my good eye and then mess something up. Then I'm in trouble.
Yeah. So I'd love the paperwork if you're willing to share it with me. I would love to have that. Okay, excellent. And that will that'll let me massage as much information through as I can.
I appreciate it, darling. I look forward to hearing from you, and all y'all, please listen to her. She will work with you. She'll get you through it, I promise.
Thank you, honey. I appreciate you.
You're welcome, my darling.
All right, bye-bye. Tell your husband I said rock on. Hello.
How are you?
Excellent.
I'm cutting the line right quick.
Hey, Dana.
How are you?
I'm good. How are you doing?
Blessed. I see the gentleman that's up in the panel right quick, but I have a quick question because I'm going to get off and come back. I'm on a date. How about that? I'm on a date tonight.
Excellent. You're on a date talking to me. So what does that say about him?
Right? It just so happens the person I was talking to next week is going to the doctor about his cataracts.
Okay.
And I wanted him to ask a couple of questions of you right quick because, of course, like me and a lot of people, putting something in your eye, it's not something normal to do, especially from somebody on TikTok that I just met 4 months ago. Don't laugh. And I'm actually sitting at the house of the lady who I told you her husband was legally blind.
Yes.
Is that they have ordered the drops also. He hasn't started using them yet.
Okay.
But they are they're looking into doing that.
Excellent, marvelous, excellent.
I'm just going to let this gentleman ask you a couple of questions, and then I'll get back with you soon, okay?
I am ready.
You're ready. I guess my concern is putting the oil in my eyes. Well, let me just say this. I have a problem following things at a distance, like a golf ball as it leaves the club. I can't follow it.
Yeah.
And I know the doctor says I have cataracts. I'm going to see a specialist. And I'm not even afraid to do that because I had a friend who had cataracts removed, and now he can't see at all.
Right.
When it comes to my eyes, I'm really skeptical about having people put things in my eyes or have any kind of surgery on my eyes. But I'm putting my faith in God and the young lady I'm sitting next to who says she's using these drops.
Because he looked at me and he said, like, you're really putting them in your eye? I'm like, I'm really putting them in my eye.
Literally in the eye.
I put them in my eyes. Okay.
It makes a huge difference.
Yeah, well.
So the question is, what can you tell him? So as far as you know, it's just cataract?
Just cataract.
Do you know what stage the cataracts are at?
Stage.
I have no idea. I have not seen a specialist yet.
Okay. Do you have any issues seeing through your eyes? So do you have like a white haze when you look through your eyes? Are there areas when you're looking forward? Are there certain areas in your sight line that are cloudy?
Yes. My left eye is cloudy.
Okay. All right. Excellent. And this is your first diagnosis of cataracts?
Yes.
Okay. This is going to be pretty easy. So I would obviously recommend that you use the Revitalize, the moisturizing hydrating eye drop, and the 3070 blend, the same blend that Dana's using.
And that's it. And so what could I'm trying to explain to him about it being a calcium buildup on your eyes is what the cataracts is and how it breaks up.
Yeah, it's actually, yeah.
It took you over a year to get both of your eyes totally.
So it's a protein buildup, and actually on the lens of the eye. And it took me 13 months to deal with the protein buildup on my left eye, which was a severe cataract. And if you heard the conversation I was having with Robin, she's got a stage 4 cataract on one eye, and I was there and a little worse. So closing my right eye, I literally couldn't see but this white haze in my left eye. So it was quite severe. And it took me 13 months to figure out the usage protocol that actually got that protein buildup knocked off of the lens of my eye.
So it took you 13 months.
Yeah. But I had a moderate cataract in my right eye, and that took 3 months.
Okay, so if I start using these drops, what's my expectation before?
Probably 6 to 8 weeks, because I think you've got mild cataracts.
6 to 8 weeks?
Yes.
Based on what you have told her, what the information you okay.
Yes.
Okay, so
I'm just gonna if I decide to do this, I'm gonna do one eye.
But your eyes are connected.
Okay, so I gotta do both eyes?
No, you don't have to do any eye.
But you only use one eye, what'd you say?
Well, what's going to happen is if you have a protein buildup happening right now in your eye, in your eyes, and they've told you you've got cataracts in both eyes, if you treat one eye, the protein buildup in the other eye is still continuing. So you're just going to have more of a buildup in that eye and have to do more work to get that eye treated properly so that you have better eyesight.
Okay, so I'm going to give you the link. We're on my phone, as you can see, and then, tonight or another night or whenever you're on, you can kind of take some time and listen to other people who are coming in and, make a decision on what they would like to do, and I'll be here.
Well, and you can read the testimonials that are on the website. You can, go through all of my older posts. You can call me and talk to me, and I can walk you through it in more detail. But I can tell you that the thing that has to happen is not only do you have to treat the protein buildup that's happening in the eyes at the moment, but you also want to treat what's happening in the eye that's causing the protein buildup.
Okay, so we'll keep listening, and if you tomorrow?
No,
No, not tomorrow. Okay.
no,
Sunday?
not till Monday again.
Not till Monday. Okay.
Yeah.
That's good to know.
Yeah, I'm gonna start taking weekends off and just doing weekend nights anyway. I'm not gonna do evenings on the weekends, just because I have to figure out how to balance being able to make as much product as I need to make and ship as much product as I need to ship.
And one last thing before I hang up, the DMSO. You know, I have a hard time saying what that is.
Dimethyl sulfoxide.
How much are eye drops?
For the 30/70 blend, the 2 ounce, which is what you're going to need, is $39.50.